And today I'm pleased to announce that we're making some progress in healthcare. First, my administration is cracking cracking down on junk fees for health insurance plans that are like the ones that are inexpensive but too often stick consumers with hidden fees. As Corey just talked about, junk fee plans are short-term health insurances that are supposed to provide a few months of temporary coverage for people who are moving from one plan to another. But the prior administration before me decided to let insurance companies make more money by selling junk plans that are up to 3 years long. Americans thought they were buying temporary insurance that would provide real coverage in those plans. Instead, many have been saddled with thousands of dollars in medical bills these junk fees don't cover. And I think it's outrageous. There are two main ways junk fees stick you with the high bills. The one way you just heard from Corey. He needed emergency surgery to get an appendix removed, but hidden in the fine print, his plan said it would only cover a fraction of the $37,000 the hospital bill was, even though he was paying his insurance premiums every month. Another predatory way of getting around protection Barack and I fought so hard in the Affordable Care Act to accomplish, protecting millions of people with pre-existing conditions like cancer and heart disease. That was a way to get around that. Just imagine if you had a heart attack and you expect your insurance company to pay for it, or you're diagnosed with a cancer and you expect your insurance company to pay for it. But they dig into your medical records, discover you had asthma as a kid, claim you had a heart attack as a pre-existing condition, and then refuse to pay. Folks, that's not health insurance. That's a scam. That's a scam. It has to end. And folks, today, my administration is issuing a new rule that would close the loophole that allows these junk insurance plans to exploit Americans. Under our rule, short-term plans would have to be short-term. That means 4 months or less, not 3 years. Insurance companies would also be required to provide a clear disclaimer up front about what's covered and what is not covered instead of burying it in fine print. Second, we're cracking down on surprise medical bills, which I thought we had made some progress on. You've already heard stories about people who choose a hospital that's in their insurance network, and they get a surprise bill for thousands of dollars because the hospital assigned them an anesthesiologist who wasn't in their network, without them knowing that. In January 2022, we ended surprise medical billing, so hospitals that are in-network can't send you a surprise bill for an out-of-network doctor that you did not choose or even know he was consulted. And over the past 18 months, we protected 1 million Americans every single month from these surprise bills. But these are bills that cost people hundreds of thousands of dollars. But get this, some healthcare providers are trying to get around the rule by putting in place the rule we put in place to prevent this surprise billings. The travel industry figured out how to charge customers $90 a night resort fees for hotels that aren't resorts. You think I'm kidding? Hospitals are trying to do something similar by using different designations to charge their higher out-of-network rates, or charging hidden facility fees for going to a doctor's office in a building owned by the hospital. And some hospitals are working with credit card companies to promote medical credit cards. Sounds good. Consumers can use these cards to borrow money to pay for the procedures and to get charged in the hospital, but they get charged higher interest rates as a result of that. It's wrong. It's wrong. Today, my administration is closing these surprise billing loopholes. Evading the law and playing games to charge patients outrageous prices has to end. It has to end.